Okay. So it looks like we are live on Facebook. And good morning, and from Geneva, and I think good afternoon from Kabul, Afghanistan. And in one of the most uplifting calls that I scheduled this year, I have a big honor and pleasure to have with me today Dr. Samar, and my amazing guest from Afghanistan, from Kabul. She is currently the chair of the Afghan Independent Human Rights Commission, and closer to our heart, the chair of the Stop TB Partnership Afghanistan. But very important, I would say, she's a human rights advocate and the former Minister of Women Affairs in Afghanistan. And Dr. Samar, you fought a lot in your life for some important principles related to the rights of people, related to the women rights and visibility, and you are continuing to doing so. And we are very honored as a TB community to also have you pushing the TB agenda, to say so, and helping us with that. If you can share with us a little bit of your experience and your work, and also if you can, and then let us know how come that you are so close to TB. Is it TB a love for you? Is it, and why? So good morning, and thank you for taking the time with me at us. So Dr. Samar.
Yeah, Rushika, it's my pleasure and honor to meet you, and thank you very much for including me in this program and including Afghanistan in this program. As you, I have to clarify that I'm not anymore the chairperson of Afghanistan Independent Human Rights Commission. I'm currently without a political portfolio, but I'm a member of the high level panel for IDP with the United Nations, and also chairing the Afghanistan Stop TB Partnership. Lushika, I'm coming from a country where there's a conflict for 43 years, and even before the conflict, Afghanistan was a poor country. And we know that tuberculosis is a disease of the poor people. And I'm a medical doctor. When I was practicing practicing medicine in my life, I saw a lot of TB cases, different, not only pulmonary, but also different cases during my practice in the country. And it is, as you know, it's not like the, let's say like pneumonia that you can treat it in a week or 10 days. It is require long-term treatment, and really to educate the patient in order to take their medicine properly and convince the family to take care of the patients and not contaminate the other member of the family. And we know that, we also know that tuberculosis is killing more people in Afghanistan than terrorist activities, although you hear about the terrorist activities in Afghanistan and mass killing and massacres of even the children 2 weeks ago in Afghanistan. But TB is killing much more people than even terrorists in the war in Afghanistan. Of course, we have, as the chairperson of Afghanistan Independent Human Rights Commission, we were documenting the casualties. We had around 10,000, some numbers of injured and killed people, but tuberculosis killing almost the same number. So that is my personal interest. And as you know, that for me, it's a basic human rights to have the right to quality healthcare and to be healthy, the right to health, and also the right to have access to quality health services. And of course, TB is one of them. That again, it is a sickness of poor people, and we are unfortunately falling on those poor countries.
Yes, it's very moving. Yes, it's very moving to hear what you are saying. Dr. Samar about TB and what is happening and so on. And indeed, you see, you're right. And now, on top of everything with COVID, in the world in general, the attention completely went away from everything else and just focused on COVID. And of course, it was because it was very abrupt and so on. But as you rightly said, and you made a comparison with, you know, how many people are dying of tuberculosis in Afghanistan and so on, you know, for example, in a lot, in the low-income countries, in the countries where there is a lot of high burden countries with TB, you know, except of India right now, TB still kills more than COVID. And it's a shame because it's a curable disease. We know how to diagnose it. We have the tools to diagnose it. They are not perfect, but we still can go a long way. And in spite of that, we accept for years and years and years for TB to kill thousands of people a day. We are for the last 8 years at 4,000 people a day dying of TB globally, out of which 700 are children. And children to die with TB in this time, in 2020, in 2019, in 2021 is a crime, as we both know, because, you know, we have a cure for it. And the kids are with TB are a victim of adults not treated with TB. Those are infected, their families. So you're absolutely right. And, you know, what we try to do, including with this kind of dialogue, as I have with you, Dr. Samar, is to bring attention to tuberculosis and the fact that it exists between us at large numbers. And also because you see, as we both know, you know, in TB, we advocated for a long time for a mask in the hospital, or when, you know, not everywhere, but when you have a person that is infected, or you have a visitor, or you have members of the family, it's good to wear a mask. We advocated for a long time for infection control measures in the hospital units and so on. We advocated for a long time to try and do contact tracing very well, because then you find all people with TB. If we had all these systems in place for TB, it would have been easier to do COVID right now, because both TB and COVID are airborne diseases, and it's you know, it's an important area to think for future, because for any preparedness or pandemic response of an airborne disease, TB will be there. So you mentioned, and I'm very happy you mentioned the human rights aspects and you know, your work on the human rights and so on. You know, I don't know, and the right of people to get access to the right care and diagnosis, to the right tools. In TB, we made some progress, but we have some long way to go. So anything that you know, comes that you would like to advise around you know, human rights in TB, or in general on the rights of people from your experience and thinking, that can be useful for us?
Yes, I think, Lushika, one thing that we see in Afghanistan, that women are usually more vulnerable to tuberculosis because of they are the one who is responsible to take care of the LP or TB patient. If it's husband, if it's mother-in-law, if it's father-in-law, if it's the child. So they are more exposed to, as they were exposed to COVID. Luckily, there's a difference between COVID and tuberculosis. Maybe COVID target more men because they are smoker, they are the drinker, they have higher cholesterol because they are eating more meat than at least in our culture in Afghanistan. So I think it's we have to really pay more attention to treat women, and because the accessibility for women to those centers culturally, and also due to the poverty and the lack of transportation and lack of a lot of cultural taboo that they cannot travel alone and so on, they are more vulnerable to the issue. And then if the mother has the tuberculosis in the family, she can be really spread to the children and the rest of the family. So that is something that we should also put a special consideration on that. The second point, I think, is really important, that we, again, promote the equality within the treatment of tuberculosis, because it might be more men to come to the hospital, but we should also follow the tuberculosis cases within their families in order to check the rest of the family, and particularly focus on women, because they are, as I said, they are more vulnerable, because they are more poor and they're getting less good quality food, I would say, because the best part of the food in our culture goes to the men of the family, and then whatever is left over of the man and the son, the husband and the son and the family, and then that go to the mother. So we have to, and then also the reproductive cases of production of children or breastfeeding of children itself is weaken their immunity. So special attention should be paid for women, and if it is possible, to provide some multivitamin and things to women during their treatment. Of course, it's not really, as far as I know, they have a package of food, but it should be, it can be very helpful if we add some multivitamin, which is not very expensive, to those programs, at least in countries such as Afghanistan. And I repeat myself because it's really the disease of the poor. So it is all, in all poor countries, we have similar situation. So many children and so many breastfeeding and so many work that the woman has to do on paper, but they don't really have the independency and the possibility to go themselves and get the treatment.
Yes, actually, you're absolutely right, Dr. Samar. We found out as well, there were, you see, we try as well to push the agenda on the rights, but also the women rights, especially in the context of several countries. Now, it looks like, as I said before, we are so many different cultures, so many countries, so many different history, but there are some lines that are common. You know, in my country as well, I'm Romanian. You know, as a woman, if you have TB, for example, is not very appealing for your future if you are not married. Or we even have cases in which, in 2 instances last year, I know of people that their husbands left. The mother-in-law advised the husband to leave the woman who had TB and take the children. And you can, I mean, we both know what it means for a woman to suddenly find herself in such a situation. It's a disaster. So we have all this past, but what you speak here, you refer in addition to the needs, to the nutritional needs and to the needs of a woman in treatment for TB, and I think that's a very good advice in looking forward. And I think we can push for adding some supplements and some nutrition to, you know, as you said, vitamins or so, to all the things that are coming as enablers of the treatment for women with TB. In addition of this, we have in Stop TB took very serious the rights, and we also gender and stigma. So we try to push a conversation, at least, in having country programs assess their programs and see, you know, are they gender sensitive enough to embrace different aspects of gender? Is stigma an issue of a program? Are the rights of people and those most vulnerable, those poor or having other vulnerabilities being respected? And we have some tools to assess the programs in this way, and we will be happy to discuss with you or with Dr. Sadiq to see how we can support in Afghanistan a rollout and understanding a bit more, what can be done, and how, in addition to, I think there is a lot of knowledge. It will not come from us, but we have some tools that can be used to assess the situation and find some ways forward. Did you observe recently, over the last year now, because of COVID, do you think that TB services were less available, to say, And I mean that not because of the people, doctors or nurses with TB being against, but we all know that in many places, doctors and nurses dealing with TB were diverted to do COVID. They had to deal with COVID, even hospital beds. So even if I want to go to a hospital, you cannot go because you don't have all the staff all the time or the beds. Is it something like that in Afghanistan as well, or a bit less, or yeah?
Yes, unfortunately, because as I said, I keep repeating myself that Afghanistan is a poor country and we didn't have enough facilities. Unfortunately, as soon as the COVID was spread, and then they actually took the hospital, which was for the TB drug resistant patients of tuberculosis for that COVID, and they transferred the TB patients to another hospital without a proper management, because first of all, it was quarantine, and secondly, part of the staff was put to deal with the COVID cases, because no one was prepared. But particularly in our case, we were not prepared to really have a proper response for the COVID. That's why we rushed and took those things. I think that is also some of the problem that we faced. We were behind. We were 13% behind on finding the patients, the drug sensitive tuberculosis patients, and we were 18% behind to target the target which was set up for 2020 because of the quarantine, because of the lack of staff. Staff was taken to the other part for the COVID, and it was also we were behind of the target for the drug resistance cases of tuberculosis, unfortunately. And I think that is sad. I raised with a colleague, and I also raised in the media that we cannot actually put the TB patient in a waiting room and not provide their treatment because we have COVID. Tuberculosis, at least something, if we just stop the treatment and we create drug resistance cases, which is more dangerous and more expensive to treat. And that is one of the problems that we have to do an advocacy for it.
Yes. And thank you for flagging this, because this is what is happening in several other in most of the countries. We observed drops in 2020 versus 2019 of as far as 30-40%.
Yes.
So countries were already behind. So it's not that everyone was doing great, and everything was matching the targets. We were already, as you said, somehow below, but now because of COVID, there is a bigger drop. And, globally is a drop of around 25 to 27% in 2020 versus 2019. And it's almost 35% for MDR-TB. So it's really a very difficult situation we find ourselves in. And the help of personalities like you in Afghanistan and others in other places to raise the points, it's very important in the country, because as you rightly said, with TB is that like COVID, like any other airborne, people infect others. And now because people stay more at home or with their families or in one room, several people, and don't go that much out and don't interact and don't get diagnosed, I think we will see not only a drop in the cases notified, but an increase in the cases with TB. So we will see a very difficult situation of what is going on there. Yeah, difficult, but I hope we can do some collective push together in countries like Afghanistan and few others. So, Dr. Samar, yes, please.
If you allow me to raise one point, I think I was also lobbying because the TB patients, particularly the pulmonary TB patients, already are weak and their immune is weak, and they are more vulnerable to COVID. And they might lose their life quicker than the normal people who get COVID. that is the reality, and that we should really do a lobby for that and push for TB program to be active, even if we have this COVID pandemic in the world, in our country.
Yes, I totally agree with you. I think we should, you rightly said, it's good to raise this, including in media and so on. So we'll see how we can, make some noise in Afghanistan, but also in your region, with people and names
Yep.
like you to raise exactly these points. It's correct with, there is evidence already from India and South Africa that indeed people with TB are more vulnerable to COVID, the forms are more complicated, and even it looks like COVID can accelerate the move from TB infection to the TB disease. So it's an entire vulnerability there related to tuberculosis and COVID. So thank you for making this important point indeed. So Dr. Samar, as we are approaching towards the end of our little chat here, it will be good if you can give some advice to us and to our partners and to our colleagues on what can we do much better to support Afghanistan, but also to support TB in the world, and any reflection as you went through a lot and continued to fight for the good things and for Afghanistan, and for the health of people and the rights of people, the rights to health of people in Afghanistan. So any advice or recommendation coming from your smart life experience will be really great.
Thank you very much. One, Dr. Lucia, I think we should jointly advocate for TB and keep the issue on top of the agenda of public health. Number one, that is something that we can do it together. Secondly, in particular in Afghanistan, I think whenever there is any possibility for or funding for different NGOs for tuberculosis, please let us know, the Afghanistan Stop TB, to know, and then we can do the monitoring. Number three, I think, again, because in the previous years, I think some of the Afghan NGOs did work on tuberculosis, but we have no idea. At least I don't have any idea about what they're doing. So we can do the monitoring and we keep them accountable for their action. Number four, I think, tuberculosis is a sickness of the poor and more vulnerable of the society. We should not tolerate any corruption in the TB process of diagnosis, on treatment, on reaching to the people. That should be, I mean, we can't really ignore that misbehavior within the system. So we have to stand united against that. And fifth, I think, please do increase the female staff of the tuberculosis, because we need to reach to everyone and to the most vulnerable group of the society, which is women and children. So women are more accessible to women rather than higher people. So if it is possible, maybe to the female close worker, encourage them to come out to in order to reach more tuberculosis cases in the country. And also I think that again, I would say that just be in touch and then we can cooperate more. And I would say that it is shared responsibility, and let's do it together. If we act together, we will be more successful. If we have cases, it can reach anywhere. It can reach, I mean, anyone can. For COVID now, they ask for a test. For tuberculosis, people still do not ask for a test, for a sputum, let's say, exam in order to be on board in the plane. For this long flight between, let's say, for 16 hours flight, you can get it from the plane, not from your own house. So you can take it to another country. So that is my humble recommendation to you.
These are really very great points that you made. And, I just want to say 3 things in response. One is absolutely right with the fact that there is now this COVID testing everywhere, while it's not the same for TB. We actually try to push together with the Global Fund on the point of doing a bidirectional testing for people that have some symptoms similar. They should be tested. If they are getting for COVID a test, they should get a test for TB in the same time, because people with some cough and fever can be COVID as well as it can be TB. So, we can for sure push for that together in many places. The second point that I want to make is actually we have my colleagues will reach out to you and to the team Afghanistan, because we have a granting mechanism called Challenge Facility for Civil Society that provide grants to NGOs. And of course, Afghanistan is one of the countries close to us and to work. So it will be possible to provide some grants there, as you said. So I know that my colleagues will try to reach to you to speak about that. And the third point in closure is to say that you are, it's really inspiring to speak with you. You are a very gracious and professional human being, Dr. Samar. I'm really happy we spoke together. I agree that we should be in touch and try and do some more for TB, because it's a lot that can be done and we can do a lot together, as you said. So I will commit here that we will stay in touch and we will try to raise our voice together for TB in Afghanistan and in the region, and also for the women that you so passionately spoke, and as well for the rights of people. So thank you very much for that, Dr. Samar. Thank you for being in touch together and for the time that we had today. Thank you.
Thank you. Thank you very much. It's a pleasure. I hope we will be able to see each other after COVID is over and tuberculosis is over.
Yeah,
hopefully.
I think, I think we should aim for seeing each other after COVID is over, because with tuberculosis it will take some time. So I want to see. Thank you so much.
Next time when I'm in Geneva, I will call.
Yes.
Thank you.
Please.
Bye-bye. Good to see you.
Good to see you. Bye-bye. Thank you.
Bye.